Show. I'm Dr. Kasey Holland, the host of our show. The Made to Heal show dives deep into the hidden obstacles that keep people sick, stuck, and searching for answers. From chronic infections and viral reactivations to environmental toxins, burnout, emotional stress, and nervous system dysregulation, we explore the complex roots of illness that conventional medicine often overlooks. Through honest conversations, patient stories, and interviews with leading experts in functional and integrative medicine, you'll learn what it really takes to recover your energy, clarity, and vitality. This isn't another surface level health podcast. It's a journey into the real mechanisms of healing, empowerment, and transformation. Because you weren't made to just struggle, you were made to heal and thrive. Today, I have Dr. Melanie Stein with us. Thank you for being with us today, Dr. Stein.
I'm excited to be here today.
Dr. Melanie Stein is the medical director of Restorative Health Clinic, where she leads a multidisciplinary team specializing in the treatment of complex chronic illnesses. She specializes in treating complex chronic illness through a cellular medicine approach, emphasizing cell membrane therapy and individualized protocols to support cellular function, detoxification, mitochondrial recovery, and immune regulation. Dr. Stein is the best-selling author of Breaking Through Chronic Illness and a frequent national speaker on chronic disease management. Her mission is to advance understanding of chronic illness and replace stigma with science, bridging patients' experience, clinical practice, and emerging research to improve outcomes and quality of life. I am so looking forward to this episode with Dr. Stein. And first off, I just want to ask, what led you to specialize in complex chronic illness?
So I think I always knew that my path was into medicine. I was in naturopathic school and I love herbal therapy and homeopathy and even physical medicine. And about halfway through my medical school journey, I was on a Qigong retreat and I actually woke up paralyzed. And I was very dismissed by the medical community. No one could figure out what was wrong with me. I had full body tremors. I couldn't move my legs. And I was dismissed to the point that I was told I had conversion disorder. And that was really a challenging time for me because I was like reaching all my dreams in medical school, and now all of a sudden I just couldn't walk. And it was really because I developed a bullseye rash. And for the listeners who don't know, bullseye rashes in the medical world means that you definitely have Lyme disease. There's nothing else that causes that. But I live in the Pacific Northwest. And in the Pacific Northwest, a lot of the physicians here believe that there's no such thing as Lyme out here, at least. So I was even just still dismissed and still told that I couldn't possibly have Lyme. And it was really through kind of walking away from the medical community and going back and turning to my naturopath, where my naturopath said no, you have neurological Lyme. Let's get you IV antibiotics. And it was a long journey. I did IV antibiotics. I did a lot of herbal therapies, different IV therapies. And slowly over time, I was able to move from a walker to a cane and back to walking pretty normally and feeling really good. I started my practice and it just became really apparent that Lyme was what I was supposed to do and I was supposed to help others through it.
Yeah, that is, so frustrating to be a provider yourself and see a bullseye rash. I was talking about this with someone earlier today too. The stigma around Lyme and still this like difficulty that we have with getting proper care for it. I don't, it's hard. I don't understand it. We have plenty of research showing like how crazy these spirochete are and all the things that they can do. And then also the bullseye rash is like traditionally what actually like if somebody hears that they actually are like, oh yes, that's Lyme. So for you to experience that is really, really disappointing. I feel like, with my patients, I've gone through similar symptoms that they have. I feel like it just changes the patient-doctor relationship because you just get it. And it doesn't mean that if you haven't had that, you can't see patients that do that, but it does just change it and make I feel like you really know what patients need on a deeper level. So tell me, you did IV antibiotics and you did traditional Lyme treatments, but it seems like you are really focusing on that cellular membrane support.
Mhm.
Is that kind of what you feel like has really helped the most and given you more, I guess, resilience with Lyme?
Yeah. Yeah, so there's a part 2 to my health journey, which is, I do think the first time around, all of the wonderful naturopathic and pharmaceutical antibiotics helped me. And then I got COVID. And after I got COVID, I developed seizures up to 20 times a day. And it was, I had to step out of practice and I was trying all the right treatments and doing everything. And, my Lyme completely reactivated. I had Bartonella, I had Babesia, Borrelia, and nothing was working. We all the best treatments were just not working. And that's when I really started to think about cellular health. I was already doing some of the cell membrane therapy in my practice, but I was really doing it on this case scenario where I've been trying everything with my patients and nothing was working. And so that's what we did with me. And I actually ended up flying to my mentor's clinic and we did about 3 weeks, came home for a couple weeks, and then went back for another couple weeks of pretty aggressive IV therapy. And so we did something called IV cell membrane therapy. And it was really through the concept of healing my cells and recognizing that my cells had become such a toxic environment that they were no longer able to receive these inputs that I was giving it. We were gently asking my body to kill the infection, and the body was just saying, I don't know how to do this. That I got better. And to be honest, I really didn't need to treat the infection that much when I did that because once I treated the cellular environment, everything else started to work again. And, I'm seeing that most of the time with my patients.
Yeah. So would you, based on that in your practice with your patients, are you typically recommending the cellular membrane therapy as kind of a staple now alongside antimicrobials or whatever
Mhm.
roles they're doing?
Yeah, I've really changed the way I've practiced in the last couple years. I think we need to meet the patients where we're at. And so sometimes, I am going in with anti-infective type agents first, but I think that the and we could kind of go into detail of the way that tick-borne disease affects our cells and what it actually does on the cells and get into the fun science of it a little bit here in a second. But I really think that if we take a step back and we heal those cells first, then we can actually create an environment for people to heal a lot faster. And so I do now, when patients are up for it, that is where I prefer to start. I have patients that fly in from all around the country to come and get a couple weeks of treatment and really try to get the cells working again. And then going in with the anti-infectives when it's warranted.
Mm. Yeah, and this conversation and this philosophy, it really kind of goes back to the roots of germ versus terrain theory of are we just, where it's that in a different kind of flavor, but it's the same type of thing of are we just addressing the germ or are we addressing the environment? And I
Mhm.
in complex illness, it's never either or. Like we have to address both. And so, and then that relationship between the two is really big. And I think that's where a lot of medicine is heading, especially after COVID, with long COVID and all the things that we've seen there. We've seen, okay, there's a relationship between how healthy you are when you come into contact with a pathogen. And I think the cool thing about the therapy that you're talking about is that it gives us access to intervene faster because these
Mhm.
are intravenous therapies, which means they're going to work faster than oral supplementation and typically be a lot more effective. So, yeah, let's tell me more about are you testing? Like, are you testing to look for cellular damage or like kind of how are you getting a baseline on how somebody's function is? Or is it mainly you're just asking them their history and going from a clinical perspective there.
Yeah. A little bit of both. Let's dive into kind of what's happening in the cell first so we can kind of understand the testing. So, when we think about a cell, our cells control everything in the body. And we have thyroid cells, we have brain cells, we have lung cells, and they all do something a little bit different. But the one thing that they all have in common is they have these structures in them called cell membranes. And these cell membranes really control what can come into the cell, what we don't want to come into the cell, and then to make sure we're detoxing and getting all the toxins out of the cell right. And those cells need to, or the cell membranes need to be arranged really carefully with a specialized fat. And they have to be perfectly arranged and buoyant and, allow us to protect ourselves. And what happens is when, Lyme, mold, COVID, heavy metals, infections come into the cell, they start to make those fats toxic and they do something called oxidizing or oxidative stress. And now that toxic fat is thick and gooey and not nice and buoyant. And so these normal structures of our cells being able to protect ourselves or to be able to signal immune communications to say, hey, something's here. We need to fight this off. Or here's an antibiotic. Please kill. That stops working. So to answer your question, yes, I am doing some testing. The testing's really changed over the last few years. And so I am doing a little bit of lipidomic testing to look at the different fats. Specifically, the one I'm the most interested in is phosphatidylcholine. It makes up over 50% of that fat in the cell membrane. And so, we're able to look at phosphatidylcholine levels and phosphatidylethanolamine levels, as well as some different fatty acids that are in the mitochondria that really can help determine mitochondrial membrane health. And then that toxic fat is called malonylaldehyde. And so we can actually measure that as well.
Yeah, and it's important to understand this because it's nice to be able to if you're, talking to a provider, if you're listening to this episode saying, I want to do this, talk to your provider about it, to be able to have a baseline, not just to see if this is something that you need, but also then as you go through treatment, you're able to see how treatment is working on that level. And I really like what you said about oxidative stress because oxidative stress is something that I've been yelling about for a long time. Oxidative stress is what Dr. Stein is talking about there is can be from, like she said, so many different things. Like it can be infections, but it can also be your daily stress, toxins, all of that. But when that's present and when the cells get to the point where they're toxic or they're not signaling properly, this is when then you have other infections pop up and that's where I talk a lot about EBV and that opportunistic infection. That's where that's happening. And so again, when we're talking about infections, it's like infections in the environment. Well, the infections then become a component of destroying the environment, basically. They are themselves creating more oxidative stress and propagating their own kind of hangout of like just all this stuff going on. And that's why, like we said a little bit ago, we have to focus on the germ and the environment. And when we do that together, that's when we see people get better. If we're just focusing on the bug, it's really when you get diagnosed with an infection, whether it's Bartonella, Babesia, Borrelia, or other infections too, like cytomegalovirus, Epstein-Barr virus, you get the diagnosis and you're like, okay, just kill it, just get it out and let me get on with my life. And a lot of times, some of the sickest patients that I've had, it's not been because they weren't diagnosed. It's been because they were diagnosed and they were given just something that kills the bug. And then there wasn't any restoration or care done to the cells, and they completely crash, and their symptoms are actually worse than when they started. And so this is something that I bring up because if you are recently diagnosed with an infection or trying to navigate this or wondering like why not just go after the bug? This is why. This is why it can save you a lot of time and energy and further decline of symptoms if we address these things. So really, really awesome that Dr. Stein is taking this approach and using these labs. So let's say the labs come back and also anytime we're doing labs, we're also always paying attention to patient symptoms. That's kind of core to naturopathic medicine because labs don't really tell the whole story unless you're actually pairing them with a person. So let's say,
Mm.
you've done your workup with the patient and the labs are also showing that they need this. What's the next step after that?
Yeah. So the next step is that, I think that you make a really good point, right? We need to look at the patient in front of us. And, sometimes it's that we're needing to stabilize their mast cells or get them out of mold first and do some of these preliminary steps to just start to tell the body it's safe again. I kind of want to expand for a second on something you just said too is, we could have treated the infections, but the body could still be stuck in something called the cell danger response. And so, even though we treated the infections, there's this process in the body that happens that when we first get an infection, the body goes on high alert and it tries. I kind of think of it as like these firefighters that are going out into the body and saying, "Hey, something's not, right here. We need to do something." And the body actually shuts down its energy production as a way to protect itself. And that further creates oxidative stress in the body. And that further is going to damage our cells. And so sometimes the first step is just to help the body know it's safe again. Help heal those mast cells, help get them out of mold, help calm the nervous system. Then the second step is to help heal the cells. So whether or not that's with some oral therapies, a lot of oral mitochondrial support, healthy fatty acids, working on diet. But then the core of the treatment are two different components, IV phosphatidylcholine and IV butyrate. And so you were kind of talking about how when we're using IV therapy, we're able to work on things a lot faster. And there's something called this bulk flow concept, meaning, you could be taking oral phospholipids, right? That's one of the questions I always get is why do we need to use IV? Why can't we just do that with oral? Well, we're dealing with a lot of our patients who have leaky gut and other gut microbes, and we're having to bypass circulation. But when we can actually give things in high, high doses in an IV, we're able to deliver it right into the tissues and use this bulk flow concept to really flood the cells with healthy fat. But we can't just flood it with healthy fat. We need to get rid of that bad fat, that toxic fat, that malonylaldehyde. And that's really where butyrate shines. And so, again, I get asked, well, why can't I just take oral butyrate to do this? And it's because there's different forms of butyrate. A lot of times when we're giving oral butyrate, we're talking about butyric acid or tributynin, which is wonderful. It has really incredible properties with helping seed the GI tract, helping with short chain fatty acid production, but it's not leaving the gut. And a lot of the times in our patients, we need to get into the brain, right? We need to get into the joints and into the muscles, all the other cells in our body other than our GI cells. And so sodium phenylbutyrate, which can be delivered in an IV form, is the form that you really need in order to scrub the cells of those fats. And then, in my practice, I'm then tailoring a nutrient IV after. And so everyone gets something a little bit different depending on what they need, but maybe it's just some methylation support, maybe it's detox support, maybe it's mitochondrial support. Everyone's a little bit different, and that's where working alongside the patient and seeing what they need to help support them through the therapy.
Yeah. When, two people can get Lyme and have completely different symptoms. One person, maybe it's neurological. One person, maybe it's more dysautonomia or POTS. And that's the other piece with complex illness is we have the core cellular support that we need, and we need to address the bugs so that they don't keep creating more problems. But then we also have to support whatever system has been taking the most, I guess, the most trauma to it, and we have to support that system. In some patients, this can look like thyroid, adrenal, especially if you've been under a lot of stress. I would say adrenals are one of the systems that I find are just so under supported in this process. But what Dr. Stein is talking about with that IV therapy allows for this process to happen faster and healing to take place faster. And personally, for like the oral phosphatidylcholine, there are some really great sources of that available now. And once you're feeling better, that can be a great thing that you take as a maintenance to like stay well and keep your cells working well and be resistant to oxidative stress because unfortunately the world that we live in has a lot of different forms of it. I mean, just living daily and walking outside and breathing in exhaust fumes from the truck in front of us or whatever,
I
I
know.
don't want people to live fear like that, but I mean, just to make us realize like, hey, we're always going to have to deal with toxins. And it's great to think that we have a liver and a kidney and kidneys, and that's what they're supposed to deal with. But I think that where we are that, especially if you have chronic complex illness and you have these infections, that giving yourself an extra buffer and support like that and having a maintenance plan can be huge, which that's kind of, post recovery and when you're there. But at that point your body isn't overwhelmed. So then those oral supplements and that maintenance is more applicable. But when you're in like cell danger response or this where you really need help and your symptoms are debilitating, that's when I think these IV therapies can be huge. Is that what you see too, Dr. Stein?
I do, yeah, and I think oftentimes when we are trying to help the body exit the cell danger response and hear that it's safe again, the body can start to receive these messages, and the body can start to take antibiotics, so sometimes usually about halfway through is when I might start to then give someone an antimicrobial or give someone an herb, and I find that, especially in my patients that have had a lot of herxing, everything you give them, they just have extreme reactions to, and I just can't give them anything. I find that when I go back in after we've kind of gotten the cells a little bit calmed down and I say, okay, you know what, let's try that same thing again. The body doesn't see it as much of a threat anymore. And the body can take it and it can work. And then we can start killing the microbes too. So I think, by no means are we sitting here saying, don't kill the microbes. But I think that the message really is that when we heal the cells and we heal the immune system, sometimes you don't have to, or when you do, it works a lot better and it can be a lot gentler.
Yeah, and I think a good example of this is mast cell activation syndrome. I've had a couple what I call health crises in my life. One was very much associated with mold and COVID, and I think I would have qualified for being diagnosed with MCAS during that time, and it was like I couldn't eat anything, like I remember I was in the airport and I was actually feeling pretty good. And out of nowhere, I think I took a supplement or something. My face like turned bright red and I was sitting there like, "Oh my gosh, am I going to go anaphylactic? Like what is happening right now?" And this was after, like it had been a while since I'd been out of the mold, and then it just, after doing therapies to support kind of what we're talking about, like right here, a lot of mitochondrial support and giving my body what it needed, all of a sudden I could eat, like now I can eat whatever I want again, which sometimes isn't a good thing because I'm like,
Right.
I remember not being able to eat. I'm really going to enjoy it. But my point is that for patients right now where they're like, I have MCAS, I'm debilitated, I have this, it can change. Like you 100% can recover. Now, I'm not saying there are some forms of MCAS that are more have hereditary influence and can be a lot more extreme and you might need medications to help stabilize. Absolutely, there's cases like that. But there's also cases like this where when you give the cells what they need and heal them, all of a sudden you don't have to avoid 30 foods and all of that. And so this idea that oh, we just have to, you know, kill the bug, take away what's bothering the body, all of that, to a degree we have to do that to stabilize you. But we have to restore.
Yeah, well, and I mean, mast cells have membranes too, right? And some of my most complicated mast cell patients, sometimes we're throwing everything at them, some of the best treatments at them to try to stabilize their mast cells. But the reality is even their mast cells have gotten stuck in this cell danger response. And, one of the mechanisms of how, the kind of we often think about histamine with mast cells, right? But we need to think about this other side of the mast cell activation syndrome, which is the leukotriene prostaglandin process, which is more of this inflammatory component. And, that's why a lot of the times we'll give like montelukast and things like that to the patients. But when our mast cells are getting degranulated and they're being released, one of the things that happens is our phospholipids on our mast cell membranes are being cleaved. And that's turning into arachidonic acid, which turns into leukotrienes and prostaglandins. And so sometimes the answer in the most complicated mast cell patients is actually to take a step back and to heal those membranes. Because when the membranes know that they're safe again, that process of that oxidative stress on the mast cell membrane isn't going to persist. And that's the answer to calming the mast cells.
Yeah, because you're not, I mean, avoiding another food or avoiding this, that's not going to repair that.
Hmm.
And the other thing with mast cells and when you're in that cell danger response is that the longer that you stay in that state where things are dysregulated, the longer those signals are going, and there's more damage happening because of that oxidative stress that we're talking about. So we want to turn those signals off, and that's what this therapy that Dr. Stein specializes in can do a lot faster than a lot of the options that are available, including oral phosphatidylcholine and things like that. So when patients are going through this therapy, what is the duration? What is that like for them?
I think probably much like you, I tell my patients, we're walking this journey together. This is not an easy process, and neither is having chronic illness. And I think oftentimes we want to just feel better. And the reality is that's not what's going to happen right away with this treatment. We are asking the body to do a lot of work to detox a lot of toxic fat and toxins and mold and who knows what else is in the body just from living in a toxic world. And so you don't feel very good at first and but you do herbs, but then at some point you do. And at some point, I have my patients, and I actually had this happen yesterday where my patient said, "Dr. Stein, I didn't believe you. I did not believe you that I was going to have this moment where I was going to leave my IV and I was going to feel so much better." And she goes, "But by golly, I left the clinic yesterday. I went home, I gardened, I had enough energy to cook dinner for my husband." And she goes, "I felt so much better." And that's really what I'm looking for with this therapy is I'm looking for at some point that shift occurring where now, you're not going home feeling tired or maybe a little nauseous. And some people do have diarrhea, giving you a lot of fat in your IV. But you go home and you feel energized and your brain feels clear, or maybe your pain is less. I know we still have more work to do because what that tells me is that now we've gotten to the point where we've probably gotten a lot of the toxins out and we're really to the point where we're deep in the healing. So usually I want to go for a couple more weeks to really solidify that healing. But that's what I live for is when the patient comes in and says that.
Yeah. Would you say that I guess just for patients' experience, like how long do they sit in the IV chair for? Is it like an
Mhm.
hour or is it 20 minutes? Because there's, IV therapy is very common right now and very popular, and a lot of times more used for wellness with IV hydration. And so sometimes when people hear IV therapy, I think they think, of that. And this is a little bit different and a little bit more specialized. Well, a lot more
Yeah.
specialized.
It is, what, maybe I'll walk you guys through a typical day of coming to the clinic. So you come in, you do heat up your arms, sit down, and then I come and I talk to you. And usually we're talking for 10, 15 minutes, listening to how you did. And how you did the day before is what really is going to determine what we're going to do today. So no 2 days always look alike because I need to figure out how hard can I push you? Do I need to change the nutrients I'm giving you to help support your liver more or help support your mitochondria? Whoa, I hit you way too hard yesterday. We need to back down today. And so every day is specialized. And I think that's really the key part of this therapy is you really need to walk alongside your patient. You need to listen to the subtleties of what they're saying. And sometimes my patients will tell me, "No, you could push me harder." And I tell them, "No, I'm not going to today." And you're sitting in the chair for 3 to 4 hours depending on what I'm giving you, you know? If I think your immune system needs more support, maybe I'm starting you with ozone. If I think that you're just having a lot of inflammation and a lot of pain, maybe we're starting with procaine or MSM. Every day is different. And at my clinic, we have a lot of other modalities. So while you're getting your IV, you're not just sitting there. Although some of my patients love to just sleep during, it kind of becomes a support group in the IV room. We have 8 chairs in our IV room, and I find that my patients end up getting really close with one another because you're usually in treatment with the same group day after day. But we have to do to support your healing and your inflammation in your cells. But about 3 to 4 hours a day you could expect to be in the clinic.
Yeah, it's different than I think what is sometimes thought of as IV therapy today with wellness and things like that. And I really like that you are using light in combination. I think we could do a whole hour talk just about light, but it is incredibly powerful for cells and one of my like all-time favorite therapies. And I'm kind of a huge light nerd, you would say now. Part of that was from personal experience when I lived in Alaska. That's when I was exposed to the mold. And when you don't have regular sunlight, and you're sick, you suddenly realize that light does so much more than just even your vitamin D levels, that when it touches your skin, it turns on pathways for detox, for repair. It actually turns on your cells. And so after experiencing that, it was a very deep experience. When I was sick, I would sit outside, and if there was light that day, I really didn't start getting better until we had light come back in Alaska. And it was crazy how much better I did when I just was able to get light. So that's another therapy that I think is very, I mean, it's becoming a lot more popular, but I think it's very underused and extremely powerful. So when you combine that's one thing with complex illness is it's the combination of therapies, right? Like it's never just a single therapy, it's the combination. If you were to do the phosphatidylcholine IV without the nutrient support that your body specifically needs, you're not going to get the same results. And I think that for patients that say like, well, I've done everything and I'm still not better, you may have done everything. And that's what's really hard sometimes is it may have been that the order that you were doing the therapies that we needed to take care of something first. Maybe it was you didn't feel safe from stress, or maybe your cells didn't feel safe because you were still exposed to mold. Maybe your cells were not ready to deal with killing. I do a lot of post-viral things, and when I do an antiviral and somebody tells me they feel awful, I don't say just push through. I say, okay, we need to shift directions here.
Mhm.
Well, when you're ready. And in traditional, the flow of medicine is you get a treatment plan and you don't see your doctor for like 8 months, not 8 months, excuse me, 8 weeks, sometimes longer. And that just doesn't work. We have to constantly shift. And I think that like we can talk about all these amazing therapies, but that really when people get better, it's because the provider was listening to the patient and really monitoring what the body needs. Like that's really what it is.
That's what I was just gonna say is that I love that you just said that because just because one treatment didn't work this time doesn't mean it's not gonna work later. And it really is, it's about walking alongside our patients. And, I tell my patients, I'm professionally unprofessional because I want you to feel safe with me. There is nothing that you could tell me that's going to surprise me, that's going to make me judge you, that I'm going to dismiss, because these organisms and these toxins live in our body and they cause the weirdest symptoms. And to some people who say that's not possible, or why does this keep happening to you? But to me, I say, tell me more. And how does that feel? And where do you feel it? Because all those little clues are what we use as physicians to help put all these little puzzle pieces together to try to figure out what do we need to do first.
Yep. That's I mean, that's the name of the show is Made to Heal, and the biggest part of that is encouraging people to not try and just silence their symptoms. Obviously, we need to support you so you're not debilitated. I'm not saying not support symptoms, but, like, we have to listen to them and not just dismiss them. Like, if I oh my gosh, the amount of times that I hear somebody say, "Well, it's just a little bit of this or just a little bit of that, and it's probably just because of this, because I'm stressed or this or that," or, the amount that patients feel like they down have to downplay their symptoms because it
Mhm.
doesn't seem like a big deal. I I mean, I don't know how we've gotten to this point, but I see it daily where it's like, no, that absolutely matters. It absolutely matters when your digestion changes. Yes, your
You
hormone.
don't have to live with that every day, right?
Yeah, like
Like,
you absolutely don't. Or just I guess what's normal, right? Just because something's common does not mean it's normal. And the amount of things that people are taught, oh, well, that's common, that's normal. You just that's aging, that's whatever. So if you're listening, you know, making sure that you can communicate with your provider and really also tune into your own body and be like, "Hey body, I'm listening to you." Because sometimes when patients come to me, they feel angry at their body or just completely like it's broken. And I always tell patients that no, it's not. And the first step is that you have to believe that it's not because your cells, our thoughts are powerful because it orchestrates how we breathe, all sorts of biochemical responses, cortisol, etc. And so the first step sometimes is even just making peace with even though you feel awful, your body is still trying to survive, trying to protect itself. It's trying to adapt and clear out toxins even when you don't feel good. And that helps people feel safe too. And that's hard sometimes because when you're debilitated, it's like, no, like it
yeah.
really comes to mind. Okay. So what are like the top two things that somebody listening today that has Lyme or complex illness, what do you want to make sure that they know?
Yeah. I mean, I think the first thing I want to tell everyone is don't stop looking for answers, because there are answers out there. And living with Lyme and living with chronic illness is extremely frustrating because there isn't that standard medical protocol of, oh, you have this, take this. I wish there was, but there just isn't. And so don't stop looking for answers, don't stop asking questions, keep looking for physicians. There are tons of us out there. iLads is an incredible organization. ISEIA is a great organization. There's a lot of organizations out there that we are all of us providers are on the listserv, so you can help, find us easier. And, I think the second thing is, listen to your body, because our body sends us messages and our body tells us when we're safe and when we're not safe. And, by listening to our body and advocating for what we're feeling, that's really how we get better.
Absolutely. I couldn't agree more with you there. Thank you for joining me today, Dr. Stein. Where can we find you? And also in the show notes will be your book, Breaking Through Chronic Illness, where Dr. Stein explains a lot of this as well as the benefits of too.
So my clinic is Restorative Health Clinic. We are in Portland, Oregon. And so, everyone is welcome. The best way to get a hold of the clinic is on our website, which I can give you as well. We have a little contact us form on there. My office manager will do a little intake. But also, I post a lot of things on Instagram. So at Dr. Melanie Stein is my Instagram. And so I love to post little medical facts and try to educate the community on there as well.
All right. We will, if you're listening, those will be in the show notes below. Thank you for joining us, Dr. Stein.
Thank you.